Oncology recipes for tumors of female organs. According to the recommendations of Jewish traditional medicine. Recipe number 1. Infusion of field pennycress, Flasby arvents, also known as stinkweed or pennycress. Drink in cases of ovarian inflammation and uterine cancer. Important. This remedy is contraindicated during pregnancy, as it may cause miscarriage. Preparation method. Pour 1 glass of boiling water over 1.5 tablespoons of dried medicinal herb. Infuse for 4 hours in a tightly closed container, then strain. Drink 1 teaspoon every 3 to 4 hours, 4 to 5 times per day. Treatment course, 21 days per month for 3 months. Recipe number 2. Mixture of aloe vera, aloe arborescens, honey, and red wine. Recommended for uterine cancer, even in cases of gangrenous tissue decay. Preparation method. Combine 375 g of crushed aloe vera, 3 to 5 years old, do not water for 9 days before harvesting, 625 g of honey, and 0.5 liters of strong red wine, 16 to 18% alcohol. Place the mixture in a dark glass jar, seal tightly, and store in a cool place for 5 days. For the first 5 days, take 1 teaspoon per day. In the following days, take 1 tablespoon 3 times a day, 1 hour before meals. Treatment course, 2 to 3 months. In the beginning, an unusual appetite may appear, this is normal. Important. Aloe is contraindicated in cases of gastrointestinal bleeding risk. Recipe number 3. Roots of greater burdock, Archaeum lapa, and woolly burdock, Archaeum tomentosum. Use as an infusion or decoction internally for gastritis, stomach ulcers, uterine cancer, and esophageal cancer. Recipe number 4. Peony, Peony anomala, also known as marine root. Use in the treatment of erosions, uterine cancer, and stomach cancer. Preparation method. Pour 3 cups of boiling water over 1 tablespoon of crushed dry peony root. Infuse for 30 minutes in a tightly closed container. Take 1 tablespoon 10 to 15 minutes before meals, 3 times a day. Treatment course, 21 days per month for 2 to 3 months. Recipe number 5. Potato broth to strengthen immunity and help combat severe illness. Preparation method. Wash 1 kilogram of unpeeled potatoes thoroughly using a toothbrush, remove the pies, pour over with 6 liters of salted water, and boil for 3 hours on very low heat under a closed lid. After cooking, drain the broth into a separate container and mash the boiled potatoes with their skins. Add the drained broth back to the mash and mix thoroughly. Let the mixture settle overnight. In the morning, collect the clear liquid that rises to the top and pour it into a clean container. Drink 3 tablespoons 3 times a day between meals. Treatment course, 65 days. Recipe number 6. Propolis in pure form or combined with butter, honey, milk, or alcohol. Take internally for malignant tumors of internal organs, including cases where the patient has undergone radiation. Propolis and its preparations can suppress cancer cells for a prolonged period, support the activity of healthy cells, and help restore normal body functions. Usage of pure propolis. Take 5 to 7 g, chew thoroughly and swallow. Repeat 3 to 5 times a day, 1 hour before meals. Treatment course, 21 days per month, up to 6 months depending on tolerance. How to prepare 15% propolis butter. Bring 1 kilogram of unsalted butter to a boil in an enamel pot, then remove from heat. Add 160 g of cleaned, finely grated propolis to the hot butter. Stir continuously for 30 minutes while maintaining a temperature of about 80 degrees Celsius 176 degrees Fahrenheit, until the mixture becomes uniform. Take 1 tablespoon in 1/2 glass of warm milk or hot water, 3 to 5 times a day before meals. Herbal collections. Anti-cancer herbal blend. For malignant tumors of the digestive organs, breast, and uterus. Aconite, Aconitum fischeri, tubers, 16.5 g. White peony root, 10 g. Angelica root, 10 g. Ginger root, 10 g. Clove buds, Eugenia caryophyllata, 3.3 g. Sauchuria lapa, 3.3 g. Preparation method. Boil the aconite tubers in water for 2 hours. Then add 300 milliliters of hot water and the remaining herbs. Continue to boil for another 30 minutes. Strain through gauze. Important: do not use metal utensils or tools during preparation. Take half a cup 3 times a day. Treatment course: 21 days per month, up to 6 months depending on tolerance. Anti-lymphatic blend. For Hodgkin's lymphoma and all types of lymph node tumors, including metastatic, this auxiliary remedy from Jewish traditional medicine may ease the condition. Young fir shoots with twigs, 1 kilogram. Forest raspberry roots, 0.5 kilograms. Sugar, 1 kilogram. Honey, 0.5 kilograms. Boiled water, 1 cup. Preparation method. Wash and dry the shoots and roots. Layer all ingredients in a glass jar, a layer of plants, then a layer of sugar or honey. Add 1 cup of boiling water. Let it infuse for 24 hours in a dark, warm place. Then place the jar in a water bath, put in a pot of boiling water, and heat for 30 minutes. Let it infuse again for 2 more days. Drain the juice, it should have a bright raspberry color. Dosage. Take for 10 to 12 days. Children, 1 teaspoon 5 times a day. Adults, 1 tablespoon 4 to 5 times a day before meals. Then take a 10 to 12 day break and repeat the treatment. Anti-cancer herbal blend. 1. Decoction of common oak bark. Cut bark from young, strong oak branches, dry and crush it. Brew 1 tablespoon of bark in 1 cup of boiling water, bring to a boil twice, then let it steam for 3 hours under a pillow. Once it cools, soak a thick cloth, like from a bath towel, in the cold decoction and apply it to the chest where the tumor is located. Cover with a dry towel, bandage it, and wear a warm knitted sweater. Keep it on for 2 hours in the morning and evening. Oak bark has a good ability to dissolve hard, non-inflammatory tumors and can also treat goiter. 2. Cleavers, sticky weed, goosegrass. Infuse 4 teaspoons of crushed herb in 2 cups of boiling water for 2 to 3 hours, then strain. Drink hot, half a cup 4 times a day in small sips. In folk medicine, both the infusion and the fresh juice of this plant are used for cancer of the breast and tongue. Herbs and spices that fight cancer. Herbs and spices can be a source of hope and support for seriously ill individuals. Some of them are even capable of slowing the development of malignant tumors. Nettle. Often dismissed as a common weed, nettle is in fact a vitamin bomb that treats many illnesses. First and foremost, it has diuretic properties, making it useful for urinary tract disorders. Nettle improves liver function, lowers blood glucose levels, and stimulates pancreatic secretory activity. It is also recommended for anemia. Additionally, it has bactericidal properties and prevents fluid retention in the body. In Jewish traditional medicine, nettle is considered helpful in fighting severe tumors of the bladder and pancreas. Frequent consumption of nettle tea can stop the growth of cancer cells. Horsetail. Horsetail is one of the oldest plants on Earth, with unique healing properties. It contains a large amount of silicon, which has a profound impact on the adrenal glands, kidneys, heart, blood, skin, bones, hair, nails, blood vessels, and more. Many experts still consider horsetail an irreplaceable and invaluable remedy for many serious illnesses. It strengthens the walls of blood vessels, preventing them from breaking easily, and supports the proper elasticity of the epidermis, mucous membranes, connective tissues, and bones. Drinking horsetail-based tea is recommended for cancer patients. Peppermint. Peppermint is a fragrant herb that has been used for thousands of years to aid digestion and relieve issues like bloating, indigestion, cramps, and diarrhea. It helps relax abdominal muscles and boosts bile production, enabling quicker digestion. If a cancer patient suffers from digestive issues, peppermint tea can be a helpful addition to their diet. Peppermint can also soothe sore throats. In oncology, it's often used to relieve painful mouth ulcers caused by chemotherapy or radiation. Chamomile. Chamomile can help improve sleep. If you have insomnia, try drinking a strong chamomile tea shortly before bed. Scientists have also studied chamomile mouth rinses for preventing and treating oral ulcers caused by chemotherapy or radiation. While the results are mixed, there is no harm in trying this remedy. Simply brew chamomile tea, let it cool, and use it to rinse your mouth and throat as often as you like. Chamomile tea is also a great solution for digestive issues, especially stomach cramps. It relieves muscle tension and effectively relaxes the smooth muscles of the intestines. Cinnamon. The main components of this spice are cinnamaldehyde, eugenol, terpenine, linalool, carvacrol, safrole, benzyl benzoate, and coumarin. To obtain a preventive effect when treating cancer, it is sufficient to consume about half a teaspoon of cinnamon per day. You should also know that cinnamon is a natural food preservative and an excellent source of iron and calcium. It effectively reduces the growth of cancer cells and blocks the formation of new blood vessels in the body. Cinnamon also limits the growth and reproduction of Helicobacter pylori bacteria, which are an important risk factor for stomach cancer. Ginger. Ginger is used not only as a spice but also as a medicinal product. Research on effective ways to fight cancer shows that ginger contains a powerful compound that can be 10,000 times more effective in treating cancer than conventional chemotherapy, especially in targeting cancer stem cells, which is crucial in cases of malignant tumors. However, that's not all. Unlike chemotherapy, this substance does not kill healthy cells or weaken the immune system. During chemotherapy, living tissues are also bombarded with chemicals, and healthy cells die. As a result of this local damage, there is a significant risk that cancer will return with greater strength and spread further in the body. Compared to chemotherapy, ginger has been found to be 1,000 times more effective. Turmeric. This spice has been used in India for thousands of years in Ayurvedic medicine. Its main ingredient is curcumin, which inhibits inflammatory reactions, acts as an antioxidant, and regulates cholesterol levels. Turmeric is a powerful weapon and an excellent treatment for cancer without side effects. Curcumin slows down the growth of prostate, breast, brain, pancreas, melanoma, or leukemia cells. Curcumin may be beneficial in the prevention of breast and prostate cancer, which are associated with inflammatory processes. It reduces the metastatic potential of these cancers. Given that this substance is well tolerated by the body, it can be safely recommended to everyone, especially those who are at higher risk. Oregano. Oregano has high antioxidant activity due to the presence of phenolic acids and flavonoids with antibacterial properties. Oregano is effective for preventing prostate cancer. The quercetin in it limits the growth of cancer cells in the body and acts as a medicinal agent. It has previously been proven that herbs and spices can replace salt and fats. Comprehensive healing juice. The base is beetroot juice. This juice is highly effective in cancer treatment. Add carrot juice due to its carotene content, celery root juice because of phosphorus, an essential element, as well as radish juice and potato juice for liver function improvement. To prepare the medicinal mixture, take 3 parts red beetroot, 1 part carrot and celery root, a little radish, and a small potato, about the size of a chicken egg. For example, for 300 g of beetroot, use 100 g of carrot and celery and about 30 g of radish. Including potato in the vegetable mix is not mandatory, but it is very necessary for liver cancer. Pass the vegetables through a juicer, strain the resulting juice through a fine tea strainer or cloth to finally remove fibers that are poorly absorbed and serve as food for the cancer tumor. The amount of juice mixture consumed should not exceed 1/8 to 1/4 liter per day. Infusions and decoctions. Sage decoction. 1 to 2 teaspoons of sage herb are poured with 1/2 liter of water and boiled for 3 minutes so that the essential oils evaporate, and important enzymes vital for the glands, spinal cord, and intervertebral cartilage are released into the solution. After the 3-minute boiling, strain the sage decoction and add St. John's wort, peppermint, and lemon balm. Let it steep for another 10 minutes. Kidney tea. A recommended blend consists of field horsetail, 15 g. Nettle, 10 g, preferably spring nettle. Knotweed, 8 g. St. John's wort, 6 g. This amount is enough for approximately 3 weeks. Add a pinch of the blend to a cup of hot water and let it steep for 10 minutes, then strain it. The strained remains of the blend should be poured again with 2 cups of hot water, boiled for 10 minutes, then strained and mixed with the previously prepared infusion. Kidney tea. It should be consumed cold, 1 cup in the morning, on an empty stomach, before lunch, and in the evening before bed for 3 weeks. After that, a 3-week break is necessary. Geranium infusion. 1/2 tablespoon of finely chopped leaves is infused in a cup of hot water for 10 minutes. This dose should be consumed throughout the day in small sips. Geranium infusion can be consumed for all types of cancer. Infusion of metasweet with yellow and white dead nettle. For breast, ovarian, and uterine cancer. Drink cold infusion of metasweet with yellow and white dead nettle, 1 cup throughout the day. A pinch of metasweet with a small pinch of dead nettle is infused in a cup of hot water for 10 minutes. Infusion of bedstraw. For cancer of the palate, lips, tongue, tonsils, and larynx. A bedstraw infusion is recommended. To prepare the infusion, 1 teaspoon of bedstraw root is poured with a glass of water and boiled for 3 minutes. Celandine juice. For skin cancer. For an affected area between 1/2 to 1 centimeter in diameter, it should be smeared several times a day with fresh celandine juice. For larger areas of damage, only the very edge of the affected area and the surrounding skin should be treated with the juice. Celandine infusion. In winter, instead of juice, a celandine infusion can be used. To make the infusion, a pinch of celandine is poured with a cup of hot water and infused for 10 minutes. The infusion should be consumed lukewarm. Do not allow the juice or infusion of celandine to come into contact with open wounds. Mixture of greater and lanceolate plantain, lungwort, ground ivy, mullein, and fennel. For bone sarcoma, lung cancer, and tuberculosis. Drink the infusion of the mixture of greater and lanceolate plantain, lungwort, ground ivy, mullein, and fennel. The mixture of herbs is infused in hot water for 10 minutes. Not all of these herbs need to be present in the mixture. This infusion can be consumed without restriction, the more, the better. For lung tuberculosis, it is recommended to additionally take 1 teaspoon of plantain seeds per day, washed down with water or herbal infusion. Infusion of potato peels. For liver cancer. Drink the cold or warm infusion of potato peels, 2 cups throughout the day. To prepare the infusion, boil a handful of raw potato peels in 2 cups of water for 2 to 4 minutes. If you like the taste of this infusion, your liver will need it. If you find it unpleasant, then you should not drink it. Infusion of wormwood or common centaury. For stomach cancer. Drink the cold infusion of wormwood or common centaury, 1 cup throughout the day. Infuse a small pinch of the herb in a cup of hot water for just 3 seconds. Wormwood infusion. For spleen and pancreas cancer. Drink wormwood infusion, 1 cup a day. For the first 5 to 6 days, infuse a small pinch of wormwood in hot water for 10 minutes. Then, reduce the infusion time to no more than 3 minutes. Infusion of small-flowered willow herb. For prostate and ovarian cancer. Drink the cold infusion of small-flowered willow herb, 2 cups throughout the day. Infuse a pinch of the herb in a cup of hot water for 10 minutes. List of some common herbs and their side effects in cancer treatment. Echinacea can occasionally cause strong allergic reactions, such as rashes or breathing problems. It may interfere with immunosuppressive medications and has a presumed effect. Garlic can lower blood pressure and cholesterol levels. It may increase the risk of bleeding. Ginkgo, also known as ginkgo biloba, can increase the risk of bleeding. Ginseng can interfere with sedation or general anesthesia and has a presumed effect. It may raise blood pressure and increase the risk of bleeding. It may lower blood glucose, sugar, levels. Turmeric may interfere with chemotherapy and has a presumed effect. St. John's wort may interfere with the effectiveness of certain medications. It can increase skin sensitivity to radiation or laser treatments.